Turning our attention to the muscles of the forearm, or the antebrachium, we will focus on 4 muscles from our lab list. So what I want you to notice in general is that there are actually very few muscles in the hand, as many of the muscles that control the movement of the hand and the fingers are actually located in the forearm. So the first muscle that's on our list is the brachioradialis muscle, and this is the large fleshy muscle at the lateral and anterior part of the forearm, since this is the anterior forearm in anatomical position. This muscle crosses the elbow joint, and so when it contracts, it causes flexion of the elbow joint. But even when the muscle is relaxed, it acts like a strap across the elbow joint, and so it helps to stabilize the elbow joint even when it is not contracting. The other 2 muscles that we can see on the anterior forearm are the flexor carpi radialis muscle and the flexor carpi ulnaris muscle. Now, the flexor carpi radialis muscle lies along the radius, because this is where the radius is located anatomically, and the flexor carpi ulnaris is located more medially, just superficial to the ulna bone. So these 2 muscles both insert at the wrist joint here, and so when they contract, they both serve to flex the wrist. Because the flexor carpi radialis muscle is more laterally located, that is, it inserts near the thumb, contraction of this muscle actually helps to abduct the wrist, that is, it helps to pull the wrist and the hand away from the midline. And because the flexor carpi ulnaris is more medially located, when it contracts, it adducts the wrist, that is, it's moving the wrist back towards the midline. If we turn the forearm over and look at the posterior part of the forearm, the one muscle that we take a look at on this side is the extensor carpi ulnaris muscle. So this muscle is an antagonist to the flexor carpi muscles that we saw in the anterior forearm, because the extensor carpi ulnaris serves to extend the wrist. If the flexor carpis are flexing the carpal bones or flexing the wrist bones, then the extensor carpi is extending the carpal bones or extending the wrist bones. Because it inserts on the medial side of the wrist, because it's located superficially to the ulna bone, it also adducts the wrist in addition to extending the wrist when it contracts.